Everyone, thank you for joining us today. Apologies for the rough start. Welcome to session 3 of our tobacco use and cancer prevention for individuals with disabilities. This is Community of Practice and presented by the National Center for Health and Public Housing and the Disability Network for Tobacco Control and Cancer Prevention. Next slide, please. Closed captioning is available for this session. To access it, please click on the Show Captions button at the bottom of your toolbar. And from there, you can select caption language or any other settings. Here depicted as A and B. Next slide, please. A few housekeeping items. You are all muted upon entry, but please engage in the chat and let us know if you would like to be unmuted by raising your hand. A reminder that these slides will be available after the meeting and everything is being recorded. Next slide, please. My name is Olajumoke Oladipo, also known as Jumoke. I am the Health Communications and Research Analyst. We're also joined today by Dr. Kevin Lombardi and Dr. Jose Leon from National Center. Next slide, please. And I will have our speakers of today introduce themselves. Thank you.
Hi, everybody. My name, let me get my video going. My name is Catherine Stone. I am with the National Association of Chronic Disease Directors, and I lead our National Disability Network. I will be co-leading this webinar today with Chris. And Chris, if you wanted to introduce yourself, go ahead.
Sure. My name is Chris Mackey. I'm a senior project coordinator in community health at the Lakeshore Foundation. And Lakeshore, we are the subject matter expert partner on with the national network on the grant with NACDD and provide technical assistance.
Okay, so I'll get us started today. So again, my name is Katie Stone, and I'm a senior program manager at the National Association of Chronic Disease Directors. I'm a white woman. I have dirty blonde hair. It's kind of brown now because it's wet, with glasses on and a white shirt. Today and during the next session, our final session, Chris and I will be giving you a fairly condensed version of what it means to include people with disabilities in your services, with an emphasis on tobacco cessation programs. We'll be sharing the presentation duties today. All right, so many of you have seen this slide before because we used it in the previous sessions, but in case you are new to the call or new to these series, I'm going to go over it one more time today. So how do we go about creating accessible and welcoming programs for people with disabilities? There is an evidence-informed framework that we have used as an approach for making health promotion programs, including the tobacco cessation programs and cancer prevention services, inclusive of people with disabilities. The framework is called the GRADES, or Guidelines, Recommendations, Adaptations for Including Disability. It has 5 domains, as you can see on the screen. They are built environment, services, instruction, equipment, technology, and policy. So within these different domains, thinking about how we can make sure that accessible is something that we're focusing on for individuals with disabilities. So most changes that you make to increase access cost little to nothing, but planning ahead is critical. So for example, if you think about your program and your services, and beforehand you say, I'll have a couple of different ways to register individuals. I might offer like a text service or an online format. I'll make sure that my font is big and I'll use plain language. Those are all free things that I can think of ahead of time. But if I'm not thinking about those ahead of time, those can cause issues and barriers down the line where potentially individuals may want to register, but they can't. And those barriers might discourage them from participating in all of the programming that you're offering. So just thinking ahead can cost little to nothing. And if you do have things that cost money, you can budget for them and make sure that you have them readily available. So for example, like offering cart services or ASL, just having that in your budget so that when you are doing a webinar and you're asking, does anybody need accommodations? If somebody does, you're able to then go ahead and do that. So this slide here is showing you some of the components of tobacco treatment or cessation programs. This doesn't mean that this represents every tobacco cessation program, but these are like the main pillars. So there's going to be that screening and referral. Then there's the implementation. So what program are you doing? On the screen, you see we have behavior counseling as the program that's being implemented. Then you have the quit journey or the quit plan. So that's going to include medications and then ongoing support. So thinking through those different components, how can we make sure that they are all accessible and inclusive for people with disabilities? So the next few slides that we do will really hone in on each of those components, and we'll talk about how we can increase accessibility within those. And then Chris, I'll let you take it away.
Great. Thank you, Katie. Again, my name is Chris Mackey. I am a white male. I'm bald. I have rectangular thin frame glasses and I'm wearing a red shirt. As Katie was saying, I'm just going to kind of walk through those four different components and talk a little bit about, certainly not comprehensively, but a little bit about what ways you can implement or what you can do to make those components more inclusive of people with disabilities. So in terms of screening and referrals, a few things to think about include a written policy, again, written policy that requires asking about any needed accommodations when you're doing intake. Having all staff who communicate over the phone with clients in particular know how to make relay phone calls, otherwise known as the National Telecommunications Relay Service. I'll talk about that in a minute. And then particularly if you offer any services online, making sure that your website meets either Section 508 standards for accessibility if you're federally funded, or the Web Content Accessibility Guidelines. So this is really an issue that is particularly obviously for IT professionals within your organization to pay attention to. Next slide, please. So these are a few of the resources you can use to address what I mentioned about screening and referral. The relay service information can be found at the Federal Communications Commission website. The National Relay Telephone Relay Service is basically a free service. We all pay for it through our taxes, and it allows people who can't use a regular phone to communicate with you via an operator. And so you have someone who is either translating or relaying what is being communicated to you, for, what is being communicated by your client or your patient over the phone. So web accessibility in mind, thinking about web access. Web Accessibility in Mind is a fantastic program out of Utah State University that has an immense amount of information and services about IT accessibility, website accessibility, etc., including links to other resources like the World Wide Web Consortium on Accessibility, which is another resource, which created what are called the Web Content Accessibility Guidelines. And these are just broad guidelines that were created by an international coalition or consortium to create, to help organizations make websites that are more accessible, or that are accessible to people with disabilities. And then finally, if you receive federal funding, as I mentioned, you're required to follow the Web Content Accessibility Standards in Section 508 of the Rehabilitation Act of 1973, which I believe I mentioned in our previous session. But you can find more information about what federally funded programs are supposed to do in terms of accessible IT at section508.gov. It's also worth noting, too, that the federal government has had a deadline of April 2026, so this month, for state and local government program websites to be accessible, but that deadline has been pushed back for 1 year. But even though that's been pushed back, it's still important to remember that your services overall are always required to be accessible to people with disabilities. So if you have online services that you provide, then you have to in some way make them accessible. Just right now, there are no standards that tell you specifically how to do that. But again, going to these resources like WebAIM at Utah State, or the World Wide Web Consortium, or any of those resources are great places to for your IT folks in particular to go to. Section 508.gov is good as well. It just only applies to federally funded programs. Next, please. So when it comes to behavioral counseling, you want to think about it in terms of what you do in person, but also what do you do in when you have services via telehealth, and I'll talk about that in a second. But for in-person services or in-person sessions, you need to consider things like accessible entrances, and that doesn't necessarily mean automatic doors, but it means doors that are not heavy to open or that can be opened. It's very, simple things, as Katie was saying, make a big difference, and they make a big difference as to whether or not a person with a disability participates. If you can't get in the door, physically get in the door, you can't participate. So it doesn't sound like a big deal, but actually something like an accessible entrance is. Um, restrooms with wheelchair accessible stalls, of course. Minimum 3 foot wide pathway through all of the spaces in the counseling areas, behavioral counseling areas. Educational materials that use plain language are written at a fifth grade reading level or lower. And then use imagery and limited text, and we're going to show you an example of that in just a moment. But those are tips that really make, particularly obviously written materials or maybe online materials, much more user-friendly, much more universally usable by people with a variety of disabilities, including people with limited reading levels and intellectual disabilities. And then having an awareness of local accessible transportation options, including time and connectivity to your location. Connectivity meaning, can someone who is dropped off, if they're riding the bus, can they be dropped off at an accessible bus stop? And does that bus stop have accessible connection to your facility? But again, it's not that you have to provide transportation, but being aware that transportation, as is for anybody else, but in particular for people with disabilities, accessible transportation is sometimes, if not often, hard to find. So that will affect the services you provide and how much a person can participate. So being aware of what's available and including how much it costs is really important for people with disabilities.
Chris, before you go on,
Sure.
we have a poll that we would like to launch right now.
Okay.
So let me do it. Let me know if you guys see the poll.
I do.
Right. So this is for all participants. We have 3 questions. So we are going to give you a couple of seconds to complete the survey. Couple of more seconds and I will end the poll. All right. Thank you so much, everyone, for participating. Please, Chris, go on.
All right. Thank you. All right. Turn that off real quick. And next slide, please, Katie. So basically, and again, these are sort of broad recommendations, obviously, for anyone who provides telehealth services. You have to provide effective communication for participants with disabilities, and then you must make reasonable modifications to your typical practices in telehealth to ensure that participants with disabilities can fully access services. That's really a rule for anything that you do, but we're going to talk a little bit about what it means specifically for telehealth. So next slide, please. So what does all that mean? Particularly for, and this is from ADA.gov, which is the Department of Justice's Americans with Disabilities Act information website. But in terms of, they have, this is a fact sheet that they have specifically about telehealth. But so some of the things that you want to consider for a deaf person, you want to make sure that intake, really for anyone, I was going to say intake should ask about needed accommodations. You want to make sure that you have access to qualified interpreters. You are not allowed to ask someone to bring in a relative or a friend or their own person to provide interpretation for them. You are required to provide it. And again, they have to be qualified. They have to be able to translate and understand how to translate what would typically be more medically oriented information. And then the platform that you use, you want to make sure that it's accurate and will allow for accurate real-time captioning. So whether it's Zoom or whatever the case may be, you want to make sure that you have a platform that allows for captioning, which most do nowadays. For a person with blindness, you want to make sure the platform is compatible with screen readers. And then if you do use videos or share videos, they should have audio descriptions or audio tracks to give the person who can't see what's going on the screen, give them a little context. And then also giving visual descriptions of something you might be showing them. So if you're showing them different kinds of medication, I'm kind of just making this up, but if you're showing them different kinds of medication, describe what it is, describe what the packaging is, and anything that, describe what you're holding in your hand, I guess is what I'm trying to say. For a person with limited stamina or mobility, allowing an aide to attend telehealth appointments or shorten appointments when fatigue occurs is something to keep in mind. And then for a person with an intellectual disability, scheduling longer appointments and allowing time to become familiar with the platform, like I said, whether it's Zoom or whatever, allow them to understand what's going to happen on the platform and if they're able to, how to use it. And then the platform should also allow support personnel, sometimes more than one support person, in different locations to participate. And as I mentioned, this is a fact sheet from the Department of Justice ADA website. Next slide, please. All right. And Katie, can you click through a couple of times? One more. Okay. So this is kind of the audience participation part of the session, or one of the parts. And one of the things I want to do is test you all and see if you can spot, if you're looking at this picture of a counseling session, what might be the barriers, and then more importantly, how would you accommodate someone with blindness or vision loss in this picture here? And you can put your suggestions in the chat. Or if you're able to come off mute, you can do that as well. No takers yet. Here we go. Ensure all visuals are read aloud. Absolutely. Way too much written material, braille or auditory versions would be helpful. Absolutely. So that alternate format. Reading things aloud. Absolutely. If something is written, and it should be read verbally and in its entirety. Absolutely. Okay, Katie, one more click. We'll go to the next category. How about someone with hearing loss? How would you accommodate them in this session that you see here? or maybe another way to put it, how would you prepare to serve someone who has hearing loss or is deaf? Making sure you have an ASL interpreter, yes, and that's something you prepare for way ahead of time, and you do that with different disability partners that provide ASL interpretation. Okay, sometimes a partner can work, and particularly the suggestion was to put a partner beside them to assist with relaying information that they didn't hear clearly. So maybe having a someone um, who can write down information to, for lack of a better word, translate it. But again, remember that you should provide services that allow people to come by themselves. So you can't require that somebody come with someone else. Open a text-to-speak option on the phone, and then handheld versions of the materials so that an individual can reference and reread. Okay. Katie, click one more. Allow time for questions. Yep. How about someone with an intellectual disability? How would you adapt or change what you see in the picture? Slow the pace down. Few people noted that there was a lot of written material. Health literacy review of the material. Teach back method. Yes, absolutely. More images and less words. Yes. That's the first one that I thought of. Go through as a group. Absolutely. That having a group discussion allows, it doesn't single anybody out. So you're working together um, to solve problems and address issues. Set guidelines for attendees at the beginning that they need to allow time and space for every attendee. Yeah, absolutely. Yeah. So give everybody the time that they need to answer questions, or even, maybe do some peer-to-peer assistance if the topic calls for it. And then I think there's one more, Katie. How about someone with a mobility disability? Any suggestions there? Move the table out. Yep. Room for wheelchairs. And again, thinking about what I mentioned before, that 3-foot wide pathway. Open the circle, make it a little bigger. Sure. Notice how simple all these fixes are. Access to enter and exit independently. If they want to share with or without arms, yes, sure. If somebody is able to walk, but maybe has some stability difficulties, absolutely, those are all good. And another one that I think would be helpful for someone with a mobility disability, as well as someone with a vision disability, is keep the environment as consistent as you possibly can, session to session, and then also describe the environment if someone has vision loss or is blind. Those are all good tips. So great suggestions. And again, I really want to emphasize how simple some of those are. Next slide, Katie, please. So this is a infographic that was created for the Great American Smokeout by our colleagues from the National Center on Health, Physical Activity and Disability, and the Special Olympics. And as I mentioned before, as you may notice, if you're able to read any of this, you may every bit of text is accompanied by an image, which we call easy read format. And so this is a good way to sort of present information again in sort of multiple formats. It uses plain language. So just a good example of a way to sort of convey information that's accessible to everyone. And the link to it is available at the bottom of the slide. And again, we will share these later on. Next, please. And
Okay.
Katie, I think, are you doing this?
Yeah, I think I just need to click the link in the chat.
Yes,
Did you put it in the chat already or no?
I can.
Okay, thank you. Or I wonder if I could have just clicked it on the screen. I don't
You
know.
might just be able to click it.
Oh. Let's see. Um, let's see if that works. Hold on. Okay. So,
We can just see the slide. You may
oh,
have to.
yeah, I'm gonna stop sharing that. Hold on. Here we go. Okay. Can you all see that?
Yes.
Okay, awesome. So this is an image and a website from smokefree.gov. This is their teen section, and it's called Vaping Reality Check. So it's looking at this here, there's a bunch of questions here, and it's leading you through these questions. But looking at this screen, and Chris really did this really well on the last screen, thinking about accessibility. Um, right off the bat, if this was your website, what would you be looking at changing to make this website more accessible? Um, Thinking about the text versus the images, you know, what they're saying. You can throw some answers in the chat there, and then I'll also go through. So actually, yesterday, me and Chris looked at this, and he did a little surprise quiz on me, and he was like, "Well, what do you think?" And
Mhm.
my background is over 10 years of tobacco control work, so prevention and cessation. And disability inclusion is relatively new as far as like a subject that I'm trying to practice often over the last 2 years is something that I'm doing because it's part of my job at NACDD. And I'm now realizing all of the important things that I didn't know when I was in tobacco control. But this could have easily been a website that I had, and I would think that it's a stellar website. It's really nice. But there is a lot of things that you can do to make it more accommodating for people. So right off the bat, you could think about the text size. You could think about the questions. Are they in plain language? Are they easy to understand? Could you add some simple images or pictures so that, again, if there's a cognitive disability or an intellectual disability, it's easier to understand with that picture linked to it. Is it a screen? Is it screen reader capable? Um, Also, you would want to check the coloring to make sure for visually impaired, the coloring here is actually good with the white against the black background. There is a website that can assist you with reviewing your websites that we can put in the chat. Chris, I'll let you chime in if I missed anything because again, you are the expert in this, and I feel like it really does take the practice, and I'm still learning as well.
Yeah, I mean, I think you covered a lot of it, and
Woohoo!
and I don't know for the record if this website has been checked for accessibility, um, but all of the things that Katie said are correct. So, you know, the questions, are they in plain language format? If they, and, you know, if you'll notice, everything requires reading. So what about that easy read format that we saw with the Special Olympics infographic where you have a sentence and a picture? You know, could you do that here? Um, you know, and I think the other thing was, and I think you mentioned this, was the imagery. Um, if it's appropriate, and particularly when you're talking about things like campaigns, um, people have to see themselves in the messaging that you're and the images that you're trying to portray. So do you, and again, thinking particularly about campaigns, do you have images of people with visible disabilities in your campaigns, and just kind of thinking about that as another demographic that you need to reach. But yeah, and a lot of websites have built-in features where you can change the text size and you could change the contrast. but making sure, particularly in this case, your IT folks, make sure that's available and things are compatible for different software and different hardware like screen readers. All of that is important, and you can get information about that at WebAIM that I mentioned before or section 508.gov.
Awesome. Thanks, Chris, for chiming in.
Sure.
And just one more example that I thought was pretty interesting. The FDA, the Real Cost campaign, and then the CDC Tips campaign, we actually provided technical assistance to those like huge organizations that fund us. Um, because their campaigns that are, national and I think most people have heard of them, they were not inclusive or accessible of people or for people with disabilities. Um, so if they did feature somebody with a disability, it was somebody that has that disability because of using tobacco products. So thinking like, what about individuals that are born with a disability or it's not from using tobacco products? And then also just reviewing their campaign to make sure it was completely accessible. We also created our own tips adjacent campaign that features individuals with disabilities, and then we have their quit stories. That's going to be launching over the next month, which we can share out once that's ready to go.
Okay. And if you want to go on to the next slide, you can probably stop sharing that.
Oh yeah, good call. Okay.
All right. So the next sort of component is medications and access to medication. Things you want to think about there in instructions and understanding if there are any instructions about how to use medication. Are they in plain language or in an accessible format? And then, as always, if you are um, working with someone with a disability and talking about medication, you want to make sure that you understand different accessible and inclusive communication strategies. Um, Access and cost can sometimes be a big barrier for people with disabilities, whether it's limited insurance coverage or high out-of-pocket costs. Um, and then as I mentioned before, transportation is a huge issue for people with disabilities because not only does it have to be available, but it has to be accessible. And so if they have to go and pick up medications, um, the doing that may be difficult if they have limited transportation options. And then looking at packaging and physical use, is the packaging easy to open for people with dexterity limitations? Are labels readable? Is the print small or is it low contrast? Much like the readability issues that you see with printed materials or websites. Challenges applying or using products such as patches, inhalers, or gum. That can be difficult for some folks, maybe if they have limited dexterity or if they have vision loss. Particularly something like patches might be difficult for them to use. Next slide, please. So how do we address that? There's a number of great resources that are out there to address sort of more accessible, more access to medications for people with disabilities. We have a organization called Accessible Pharmacy that's part of our national network and is a fantastic partner. But they are essentially a mail order pharmacy. They provide accessible medication services and other supports to patients with disabilities with an emphasis on those with vision loss. There's a Script Talk from Envision America is an app that helps both that allows individuals to helps you read labels, helps you read medication labels. Um, let's see, wayaround.com is an app uh, that has both pharmacy labels and home labeling solutions. And then QR codes. It provides QR codes for certain medications. Be My Eyes maybe is an app that you have heard of before, but patients can contact a third party for support to use an AI tool to read different labels. Meta has their glasses that can use AI to read a label. And then the National Institute of Medicine has all medical prescription details in screen reader compatible formats, and then this can be texted or links to or emailed to patients. And then there's many different optical character recognition and accessible apps that can convert text to speech for people with vision loss. So for medication, particularly for people with vision loss and dexterity issues, that's where the barriers come up quite a bit. Next slide, please. Related to ongoing support, some of the barriers that come up, limited follow-up options, only, so for example, some agencies only use email follow-up. Oh, that's the only thing offered. Inflexible communication, and so maybe there's no options for text or phone support or different ways to communicate. And then lack of long-term support can sometimes be a barrier. So no checking in after a program has been completed for a lot of individuals. That's an issue. Next, please. I think particularly with ongoing support, but I think throughout the whole process of engaging in a smoking cessation, tobacco cessation program, involving a person's support system if they have one, so caregivers and other support personnel that they rely on for transportation or whatever the case may be, doing daily activities of daily living is really important. And oftentimes those individuals could benefit from cessation programming as well. As we mentioned too, in a lot of interventions, the information is passed via text. So if you do that, you want to make sure that you keep your text simple and in a sans serif font. So something like Arial or Helvetica, for example, avoiding fancy fonts, avoiding emojis, using text only, and then keeping links short by using link shortening services like I think one's called Bitly. So those are just different tips that you can use if your program is text-based. In terms of programs that might be email message based, again, thinking of simple sans serif fonts, making sure that you put alternative text, which are also called alt text or alt tags on images. So they describe images for people who use different software, screen reader software, but can't see an image. And then using descriptive links instead of, or just using descriptive links is another sort of tip. In other words, not saying, click here. I mean, describe what the link actually is when you have information on your website. Next slide, please. So I will go ahead and turn the rest over to Katie.
Okay, awesome. Thanks, Chris. So don't forget about an action plan. We've talked about that over the last few sessions as well, and we'll continue to talk about that. Because organizations and people can say, we want to focus on equity or we want to focus on disability inclusion. But unless you write it down and you have a plan, it might be forgotten or pieces might be left out. You want to make sure that you identify, what is the barrier, what is the challenge that you want to address. How can you address it with that solution? Who are the people that are responsible or the partners that you're going to be working with to do that? Definitely thinking about those disability-led or those disability advocacy organizations to support there. What is the timeline that you're looking at? We'll start with something that's that low-hanging fruit, moving on to maybe a 6 months to a year with maybe bigger policies with that longer time frame. And then what are the action steps to achieve that? So really putting to work what you want to do there. So we do have some resources on the NACDD resource library website. It's a digital hub that holds our tobacco resources. There's general tobacco prevention and cessation resources, disability inclusion specifically to tobacco tobacco control and cancer prevention, health systems change, resources, and insurance coverage. So lots of good information there. We also have webinar recordings, which include like a Disability 101, Disability Inclusion 101 webinar, which really gives you that basic information, especially if you missed session 1 or 2. We also have a partnership one on there, as well as some fact sheets to support those webinars. So if you're interested in those, take a look at our website. And now we can open it for questions and answers. If
And
anybody has
Katie,
any. Yes.
there is a question in the chat about where to look for the Tips Adjacent campaign. And, I would imagine the resource library is one of those places.
Yeah, so the Tips Adjacent campaign will be available in our resource library. But if you are part of our network, so the Disability Network, we'll be sending it out to all of the people on that listserv. If you're not sure if you're part of our network and you want to be part of it, please just add your name and email in the chat and I'll make sure to add you. And then Chris, if anybody does that, can you just copy and paste for me? Like
Sure.
send me an email. We'll add you to our listserv, which you'll be getting. You get a quarterly newsletter with information about disability inclusion for people with disabilities, all of our upcoming opportunities and resources, as well as the Tips Adjacent campaign. It's not completely ready to launch yet. We're in the planning phase of like how we're launching it. So that'll be over the next month, just to be clear about that. Any other questions? Okay, if you do have any additional questions, you can always email me or Chris. And we'll be happy to answer those. Do we have the post-evaluation survey that we can put in the chat?
Yes, so thank you so much. This is a reminder to complete the post-evaluation survey that you'll be receiving in an email following the session. So thank you for joining us today. Thank you for your participation. And we hope to see you at the next session, which is session 4.
Okay, thank you, everybody. Have a great rest of your day.